Welcome on this Sunday night in the heartland, the East Central Plains of Kansas, on your blowtorch, KOFO 1220 103.7 FM. Welcome into all of our listeners here. We're the country music giant of the East Central Plains, and we, as you know, are your official voice of the Kansas City Royals, the resurgent Royals. And you are listening to our third leg on Sunday nights here on Sunday Night Prime Time. Boomer Takes with Pete and Jake, Dr. Peter W. Tinsman, MD, and yours truly. We're kind of like two grumpy old men kicking around the coffee or a martini, perhaps, on a Sunday evening, talking about a potpourri of things as grandpas are wont to do. We're kind of in that semi-retired mode, but lots to talk about. But Pete, I want to introduce a friend of ours. We're cross-pollinating. A lot of you guys have heard Dr. David Hartsuch, along with Dr. Ted Fogarty, on a lot of our radio broadcasts. So we're going to do like what in the old days on CBS they did, when they would cross-pollinate the cast from the Beverly Hillbillies to Petticoat Junction and Green Acres. And then the Petticoat Junction Green Acres folks would go on the Beverly Hillbillies. So we're doing this beautiful cross-pollination tonight. Pete, remind them who you are, and then we'll bring David in. Both these guys are MDs par excellence. Pete.
Oh, John. Oh, boy, we went to medical school, right?
Yes.
Yeah, no, yeah. Dave, I grew up in Bettendorf.
I know.
You know any of my family?
Yeah, in fact, I think I knocked on your door.
When?
I ran against Maggie Tinsman in 2006.
Did you really?
I did.
He was the one who beat Maggie, Pete.
Oh, did you beat Maggie? Were you the one?
I did. I am the one.
You know what? I remember. Okay, this is all coming back to me now, because I remember when she lost, because she had been in the Iowa Senate for a number of years. I don't remember how many. And I remember her losing to a ER physician. And so I never knew that. I didn't follow it.
So welcome, Dr. Tinsman. Welcome, Dr. Hartsuch. So I'm going to go back to COVID and just tell our radio listening audience that I was saved by ivermectin protocol. And Dr. Hartsuch, you have done some study of how Nebraska and Iowa handle...
Wait, before we do that, let me talk just a little bit about when I was an ER doctor, very early on. Somebody got the brilliant idea, let's give all beta blockers, let's make sure that everybody gets a beta blocker who has an MI. So if you have an MI, you have to have a beta blocker.
Can you
a heart attack, a myocardial infarction, a heart attack, right?
Can you explain what a beta blocker does?
Yeah. Oh, yeah. Beta blocker slows down your heart, reduces your blood pressure, so there's less work on the heart. It really sounds good, like a great idea. And lots of people do get beta blockers, but you don't give beta blockers to everybody, okay? When they made it a quality control measure, they started incentivizing the institution so they got paid based on their quality control measures, which included beta blockers in MI. And the result was they had us giving beta blockers to everybody, including those people who really shouldn't get them at all. So what we tended to do, I hate to admit it, but we gave subtherapeutic minuscule doses of beta blocker just to say we did. Okay? What this shows is that the institution can dictate behavior to patients contrary to the best medical advice that the patient should be treated.
This is a subject for another time. I never was like that. Granted, I didn't work at an institution. I was at a multi-specialty clinic that the doctors owned it. Nobody could walk into my office and fire me. And I just did what I thought was best. And it wasn't
let me ask you this.
I just box, you'll get better reimbursement. No, I'm not listening.
Let me ask you this, though. No. Is your clinic still alive and well, or has it been bought out by a hospital?
It is still alive and well. The doctors refuse. And we've had, back in the late 90s, early 2000s, there was some big organization that wanted to buy us, and we said, no way. And
how about, let me ask you this. Does that institution influence whether they recommend the vaccine? COVID vaccine?
I'm sorry, say that again.
Does that institution,
You mean the
that you
clinic
used
where I
to work
worked?
for, the clinic you used to work, do they take any quality control measure? In other words, are they monetarily incentivized in order to encourage the use of the COVID vaccine?
I don't know. I
Or-
was retired by then, so I don't know if they were or if there was any sort of incentive.
What about for pediatric cases? The percent of kids who are vaccinated for tetanus, let's say.
Yeah.
Okay. Did you have any experience with that?
No, because I'm obstetrician and gynecologist. So when my wife asked me something about kids, about what's wrong with their child, I said, I don't know, call the pediatrician. I just get the baby out.
Let me say one more thing.
Okay.
The fact that your friend's mother lived, I have a suspicion that your friend figured out the best way to treat your mother and made sure she got the best treatment possible.
I'll ask him that tonight. I'll ask him.
I had a young lady from Dubuque. She called down to me because she had cancer, and she had Medicaid, and her doctor could not find anybody to refer her to. She had no doctor, no oncologist. Okay.
Because they wouldn't take her because she was on Iowa Medicaid.
Uh-huh.
Okay.
So I said to her, I will try to find you an oncologist who takes the Medicaid. And I found her one in Macokota.
Okay.
Okay. But this is something that her primary care doctor should have done, should have called around and found her, come hell or high water. She deserved an oncologist for her cancer, regardless of whether she has Medicaid. You know?
That really
is.
Yeah.
She called me 3 months later. She called me in a hospital she was at. She said, I just wanted to call you and tell you what happened with me. She was dying of cancer, no doubt about that, but she was grateful to me for finding her an oncologist.
Yeah.
So Doc,
Okay.
I just want to leave this pause for thought. We were talking about ivermectin, fenbendazole. I was put on a great ivermectin protocol, convinced it saved my life and cleaned my lungs out in 24 hours when I was a legislator serving with a wicked case of COVID. And things were different in Nebraska versus Iowa in terms of how free doctors felt they were to administer such prescriptions. We had some heroes in Nebraska that were using ivermectin and hydroxychloroquine regularly. It was not allowed or encouraged as much in Iowa. Did Nebraska, apples to apples, save more lives during COVID than Iowa?
John, this is an area that I'm not free to talk about still.
Okay, gotcha.
Okay,
gotcha.
I've had a 3-year course. I had a 3-year case against the Board of Medicine, Board of Pharmacy for abridging my First Amendment rights to speak about COVID. And basically the Supreme Court determined that we're not going to take it up. Okay?
Gotcha.
Not an issue.
So they
You
just
got a problem with speaking, take it up with the boards.
Yeah.
The issue is our court system willing to address the free speech issues of licensed professionals? The answer to that is no.
No.
Our court system has washed their hands of it and said, here, boards, you can suppress our speech as much as they want. We're not going to get involved. So we have no recourse with regard to free speech.
Well, when I during COVID, even though I was retired, I keep my board certification. I get a letter from the American Board of Obstetrics and Gynecology. It basically says in so many words, hey, if we find out, you are going to you're disseminating misinformation,
Right.
we will, take action against you and, revoke your board certification and, things are really bad, blah, blah, blah. Maybe you lose your medical license. And what I found so crazy was, well, I might not agree with this and I want to do something else what I think is best for my patient. And you're telling me that I can't even talk to them about this? Are you kidding me? And that's what I found. And that was one of the things where I'm like, this doesn't smell right. Something is not right here. And it's kind of like, this is never how medicine's been. If you don't agree with something, you talk to a colleague, oh yeah, this is how I do it, but that's not a bad idea. You talk to somebody else, oh yeah, why don't we try this? Da 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 da. You're trying to figure out what's the best thing you can do for your patient. And I don't know. When I was in residency, one of my staff said to me, he said, Peter, these protocols that everybody's treated the same way. He goes, I don't agree with them because God made all of us differently. And yes, will majority of people respond to this protocol? Absolutely. But not everybody. And so you always got to be think outside the box. And it was like, yep, you think outside the box. And during, COVID, that's another discussion, but that's where people who were thinking outside the box got blasted for what was the real reason that they were blasted.
Right.
All these doctors were trying to do is help the patient. I think maybe we're not thinking clearly here. We need to consider something else. We need to think outside the box. That's all they were trying to do is to help.
I think the issue of misinformation is critical because nobody can define what misinformation is.
What's interesting, I think, who was Tim Walz or something when he was running, or he said something about, freedom of speech. I don't think there should be freedom of speech when there's misinformation. Did he say something like, did you hear him say something like that?
He's nuttier than a fruitcake in Yuletide.
I thought it was him. Maybe it was somebody else, so don't hold me to that. But this person had said, if somebody's giving, like John Jacobson, if you're giving misinformation, then you don't have freedom of speech. You're not protected by the First Amendment. And then I said to myself, it's like, well, who's determining what is...
Peter, you've just lurched into an Orwellian world of Animal Farm in 1984 with some warmed over Stalinism to coat it with sugar on top. It's exactly what you're describing.
He said. Why does Mr. Smith, who's in president or whoever, why does he get to determine what's true and not true? Maybe he's wrong.
Yeah, it's warmed over Stalinism that Orwell correctly predicted decades ago. And, Orwell saw what the communists, he found out they were actually the evil bad guys in the Spanish Civil War. And, the scales fell off his eyes. Yeah.
I think we got off the track here a little bit.
This is a great live radio, guys. This is shaken and not stirred martinis with Hartsuch and Peter.
And we're going to talk about making your own home guacamole shortly.
We'll invite Hartsuch back because Hartsuch makes his own bread. We're going to talk about that next time, David.
You gotta bring Peter back again because Peter, what I like about you.
Well, John and I are on this every week.
Yeah, no, but what I like about you, Peter, is it is nice to have the perspective. You're not an average doctor. You're a doctor who knows how the average doctor thinks, and you are willing to consider being out of the box.
Yes, exactly.
You have to consider being out of the box.
I know, but that's not the case anymore.
Look at did Christopher Columbus, did he think outside the box?
Absolutely.
Yeah, he did.
Yes.
I mean, it was,
Magellan.
Conspiracy.
Tesla.
Yeah. I mean, these people, Christopher, excuse me, the world is flat. You're going to sail off the end of the globe, off the end of the earth. No, I'm not. I think it's round.
Yep.
People thought he was a wackadoodle.
Absolutely.
Yes.
Exactly. When somebody brings up conspiracy theorists, and I said, okay, this is my theory. Okay, the three of us here are talking. Okay.
Yeah.
And I'm saying something, and David says to you, John, oh, Peter's a conspiracy theorist. And so what happens to your brain right away, John? It's like, I'm immediately going to dismiss everything Peter's saying.
Right.
Okay. And really, it should be like, okay, maybe he's talking about something completely different, but think about it. Is there some validity there critically think yourself.
Yeah, as I always tell people, just because you're paranoid doesn't mean people aren't out to get you.
That's right.
Peter, I will say that as I don't take insurance in my clinic. I do have a clinic, and most of the people who I treat are people who have been rejected by the main medical system. Like fibromyalgia. Fibromyalgia, man, I'm knocking that one dead. I mean, that is incredible. Many doctors don't even believe fibromyalgia exists.
Yeah, well, we're throwing this in. This is a waste bucket diagnosis because we can't figure out what really you have, and so now you've got fibromyalgia. That's what fibromyalgia is. You got your chronic pain. I don't know why, so you've got fibromyalgia.
Yeah,
what can I do about it? Yeah, don't
and
really.
What I'm doing is I'm putting them in the hyperbaric chamber, and lo and behold, the fibromyalgia, the pain goes away.
So
it's really amazing.
So I had a patient one time because I sent patients to acupuncture. It's kind of it's been around for thousands of years. Yeah. So I had this girl. She's about 27 years old, maybe 25 years old. Lived up in the Twin Cities. Was having just these different medical problems. Didn't feel right. Had seen the University of Minnesota. Saw her doctor in Minneapolis. Sent the University of Minnesota. Done a bunch of tests. I don't know. Sent her to Mayo Clinic. Bunch of tests. I don't know. Her mom and dad bring her to see me, and I'm like, okay, well, I'm going to be very honest with you. You've had $1 million workup by some really phenomenal institutions, and I would be really wrong to say, oh, I can order more tests and figure out what's going on. I said, have you ever thought about acupuncture? And I had never done it, and it was just like, I had read some things. I'm like, try it. And she went off and had some treatments. I saw her a couple months, 3 months later, and she was markedly improved. And her improvement started, within, days of getting after she's had several treatments. And it was just kind of like, was it the acupuncture that did it? I don't know. But
that was great advice. I hope nobody needled you about it.
But it was kind of like, just try to do what's right. I mean, it's like, what's it gonna, really work for her? I don't know. Being a doctor is, we practice medicine because it's not an exact science. This is not physics.
The big problem I see is that we've allowed institutions to buy the clinics, and the result is they can once you become an employee,
amen, brother.
You can become controlled by
you
your.
Hit the nail on the head.
Hit the nail on the head. I was talking to a girl who's in medical school right now. She's a third-year medical student, and I said to her, when you finish your residency, you do your darndest to go into private practice and not be part of a big group. You will have more freedoms and stuff. I am so happy I worked where I did. So happy because you had the freedom, and these people who just work at they're just a cog in the wheel when they work at these health systems. My doctor in Florida, he's on his own. It's concierge medicine down there, but he's on his own. He just does what he thinks is right. Nobody's telling him what to do. He worked for a big system down in Florida, didn't like it, and says, I'm going on my own.
We've got to get back to that. We've got to get back to reestablishing a true doctor-patient relationship. Again, the evils of a communist, socialist, interference state that was ushered in with Obamacare has been ruinous. It's been ruinous. Americans are the sickest people on the planet, ladies and gentlemen. The most affluent nation has the most chronically ill people. That should make you sit up and take notice. I am grateful myself for Donald Trump and Robert F. Kennedy Jr., that they have the intestinal fortitude, despite being up against insurmountable odds, both of money and hierarchical establishments, to start to put a dent in making America healthy again. I genuinely am appreciative.
It's so important. Before we went on the air, y'all were talking about Field of Dreams in Dyersville, Iowa. And, in the Field of Dreams movie, the part of where who played
Burt Lancaster crossed the threshold,
is walking down the street on a foggy night with his bag. That really, I think, epitomizes medicine. It's like, I got my bag. I'm going to go make a house call. I'm going to do what I think is right for the patient. When I was in Central America and South America working, we just did what we thought was right. Nobody's telling, and honestly, I mean, I loved my patients here in Dubuque. My God, they've got some amazing people, but doing that in that environment was just spectacular.
Right. Peter, you mentioned that you love your patients.
Yeah.
And I've worked as an ER doctor for 25 years. But it was not until later in life that I really began to love my patients. And now that I'm out in my own clinic for the last 5 years, I truly love my patients. And they know it. They feel it. And they come to me because of that.
Well, look at the pro bono work that both of you have done. Dr. Hart's such a lot of pro bono for those that don't have resources. Dr. Tinsman, you with your medical mission work all over the world, south of the equator, and really tremendous. Guys, we got to wrap this up. Thanks to Dr. Peter Tinsman and Dr. Hartsuch for both parts 1 and 2. We'll give you the final word, David.
John, I wanted to get into the issue of increasing VO2 max and what is going on with the military. That what I'm working on, 25 to 50% of our kids in America that want to join the military can't, because they cannot either make the physical requirements or the mental requirements required to do well on the entrance test. And what I'm showing is that the military can increase their recruitment and retention if they employ low-grade hyperbarics into the recruitment process.
Have you seen patients with this therapy go on to pass the cognitive or physical tests where they were having troubles before?
So far, I've only done one, and I've got 1 and 1. Okay.
All right.
However,
we'll have to address this down the line. This is great stuff.
Two of the recruiters are training to be Green Berets. And what's interesting is they have certain time requirements. It's really, for a 2-mile time, they have to be, it's 11 minutes, 45 seconds is what they have to do. I'm sorry, not right. I'm sorry, 13 minutes, 45 seconds for 2 miles. That's the normal time for a Green Beret. And both of these guys were close to that. They were in the range to treat. And I said, if you do this, you will drop time off here. So they dropped 1.5 minutes off their running time. Both of them have dropped 1.5 minutes off their 2-mile run. They were doing roughly 14 minutes to begin with, and now they're down about 12 and a half.
Doc, where were you when I was doing my law school admission test? I was afraid I wasn't going to qualify. I was down to the last question. I needed to get it right. It was an essay. I was running out of time. And they asked me to differentiate between ignorance and apathy. I was angry. I was stressed. I wrote, I don't know, and I don't care. And they said that was the right answer. Ignorance and apathy. I don't know, and I don't care.
What was your question, Peter?
I don't know. John just makes my head spin sometimes.
Yes.
I just try. I'm just trying to figure out how he's made it this far in life. No, it's like, no. So the hyperbaric thing, people listening are like, well, probably insurance doesn't cover it, would be my guess. It does not. No. Okay. And what is it? What is a typical cost of one treatment?
One treatment is $125, and I think that's
No,
but most people buy 5 for $400.
Okay,
so
that's fine. So if people out there who are listening saying, you know what, I'm going to give this a go. If I can get my VO2 increased and it stays up there, and then we'll just kind of gradually come down as I age. It comes down with my age. If I can boost it now to maybe help, I'm noticing some memory issues or maybe physical things, aches and pains. If this can be helpful, so $400 would be 5 treatments.
Yes.
Once a week.
And I always give the first one for free.
Okay, and that's once a week treatment ideal?
I think that's reasonable. Yes, many
Okay.
people. Yeah.
I didn't know if you
let's say
say
once a
every
week.
3 days in certain situations or once every 2 weeks or
No.
So basically 6 treatments for $400 with the first one free.
6 treatments. You said 6.
Yeah.
Okay.
Yeah. If
You
people
see, I
want to
didn't
try it
remember
out,
you
just
said
come,
6. I thought you said 5. So maybe I need it because my brain isn't functioning properly.
come on down, and I will give you the first one for free, and you will see and think about what you think.
Okay.
First one for 3, and then it does 5 for 400. So
Yeah.
you're down
5 for
to what?
400.
Yeah.
Okay, so here's another question for you. Somebody who wants to go buy one of these bags, these soft tents, what do they run?
Yeah, they run about $6,000-7,000, and the ones that I use in the clinic are 15,000.
5,000?
1.5, yes.
15,000. Okay.
And because these you can sit in these. I have a recliner chair in there, so they sit back. Most people just go to sleep for a while. They might read a book.
Okay, so it's not like you're laying in a sleeping bag
No,
sort of a thing with the thing over. Okay, little
No.
tent, little bivy
I don't know
tent.
if you can.
Okay.
They're kind of they're about 6 feet tall and 4x5 at the base, and more like a pyramid.
Okay.
All right, guys. Well, listen, we're going to
But-
bring Heart Such back. This was so good. So much material. I credit my engineer, Sean Torres, always for
Thanks, Sean.
breaking this great hour into 2.5 hours of programs here that will carry us through the midpoint of May on Boomer Takes with Pete and Jake. The great Dr. David Hartsuch, MD, joining us along with Dr. Peter W. Tinsman, MD, both hailing from the great Quad Cities on the mighty Mississippi River. For Sean Torres, my magnificent engineer, award-winning engineer, as we have programming that won again, both in Kansas and in Iowa, broadcast news associations. Until we meet again, go to KOFO.com, pull up podcasts, look for Boomer Takes. You can pull up this show and share it with your friends. As always, on 1220, 103.7 FM, Jake here with Pete and Dave and Sean saying, till next time, be safe, be smart, be good, be strong, love Jesus Christ, and God bless us, everyone. Bye-bye.